It's an honor to be here today to share the afternoon with you. And like she said, it is Eclipse Day, so happy Eclipse Day. But we'll get you out here so you can get the peak of it if you're interested in that. But I'm glad that you did want to spend a little time with us today, discussing a very important topic. Some medication safety concerns and some drug interactions. And just want to say thank you to Ms. Vanessa for choosing me to speak, and our administration team for allowing me to speak today, and thank you to the library for hosting these events. Just a little bit about myself. For those that you don't know me, I can look out and see a bunch of friends and some family as well, and some co-workers, but I'm a lifelong resident, like Ms. Vanessa said, of the Sylacauga area. I call Coosa County home. Live on a farm that's been on our family for almost 100 years now. Grew up there and decided to come back here and graduated from Sylacauga High School in 2004. I can't believe it'll be 20-year reunion this year, but it's upon us. Like Miss Clifton and I were talking about, the time flies, so it's blinking, it's 20 years ago. After graduation, I attended Auburn University, where I graduated in 2008 with a bachelor's in biomedical sciences, and then in 2012 with my Doctor of Pharmacy degree. Married to my wife Megan. We have two beautiful daughters, Mary Griffin, who is 3, and Sarah Beth, who is 1. Active at the First Baptist Church here in Sylacauga, where I serve as an active deacon and leader of the Brotherhood. And I've been at the hospital since January of 2019, serving as the pharmacy director. So a little bit about my CVM story. It started out, I guess, quite a long period ago, because my mom worked at the hospital for roughly 30 years. But there was a class through the high school that you could leave campus and go to the hospital and work and volunteer, and that same class is still in effect today in some shape, form, or fashion. And we have high school students that rotate through the facility. They rotate through the pharmacy department, and that's a very big thing for recruitment and retention, and because we want to keep those students after they graduate and earn the various degrees that they would like to earn. We want them to come back. So I'm living proof that program works, because I started out in the pharmacy just as a volunteer student in 2003, and did that for the school year, and then was retained on in a PRN role to work weekends, evenings, holidays, summers, just when they needed a little additional support when it would work out with my schedule. So, it's very fortunate to do that, because that's where I fell in love with pharmacy. I had a great mentor at the time, and he's still a mentor today. But he was the director of pharmacy then, and so kind of a neat story to come full circle to come back to where it all started for me. So let's dive into what we're going to be talking about today, and just going to start off with what a pharmacist does. We're much more than just the dispensers of the medications. Obviously, that's our primary job. Is it gets prescribed and we get it out to you. But the first thing that we have to do once we get a prescription or an order that hits our department or drugstore is we have to first determine if it's appropriate for you. There's many things that goes through our heads. Is this the right dose for you? It could be weight-based. We calculate those to double check, and just all around to see if it's appropriate. Does it interact with any other drugs that we're going to talk about a little bit later? Does it interact with any of the disease states that you may have? And we also, if we find issues, we're going to contact your doctor to discuss those on your behalf. If we're in a hospital setting, we have some protocols that we can automatically adjust things. A lot of times, medications have to be dosed according to your renal function. Well, that means your kidney function, and so we can dose those down to an appropriate level. We also advise our medical staff and our resource to them and our nursing staff. We compound medications, and that's a big deal at the hospital because there's 2 different types of compounding. There's sterile and non-sterile compounding. Sterile is when we take a medication that, let's just give you an example, we have a pediatric patient that gets prescribed 320 milligrams of Rocephin. Very common, something that we do routinely. Well, they don't make 320 milligrams, so we have to take a 500 milligram commercially available vial and safely keep it sterile and get it to the right appropriate dose. We counsel patients and provide immunizations. So medication safety. Medications are, we take them to relieve our symptoms and to treat, various conditions that we might have. And when they're prescribed, and when we use them as they are prescribed, they're generally safe. But, as with anything, there's always a risk with any kind of medication. So that's why it's always important to talk to your pharmacist, talk to your doctor, be informed, ask questions, and know what you take. We'll talk a little bit more about that in just a few slides. The pharmacist is the drug expert, and we're here to help you. We're here to help the public. We have a responsibility to do that and to help prevent any side effects and adverse drug reactions. But as you can see, a high number of adult Americans take at least one prescription medication a day. And as you can see, 29% of us take at least 5. And our senior adults take usually that or more. And that's why it's very important to know what you take and let us help you. And there's also, we're likely to see more adverse events happen throughout time because we have new medications constantly coming to market. We're finding new ways to use older drugs and find out over time, they've been on the market for 30 years, that it can help with something else. And also an aging American population, because that, like I said, those senior adults usually take more medications and you have an increased risk for adverse events. So drug interactions. By definition, a drug interaction occurs when the pharmacological activity of one drug is affected by something else. And that something else can be another drug, it can be a food or a beverage, it can be a chemical. And so you've got the object drug, which is the drug that's affected, and you got the precipitant, which is something that causes the interaction. They're mostly always undesirable, and they're responsible for adverse effects. So different types of interactions, or the effects that you can get from interactions. They can be additive. So an example of that would be is if you have a medication that you take to help you sleep, and then you take an antihistamine on top of that. Antihistamines can make you drowsy, so between the medication that you were taking to help you sleep, which that was the intent, and you pour this onto it, it can intensify it and add on to the effect. Another effect, it could be synergistic. The interaction makes the drug work too well. Or it can be the opposite of that. It can be an antagonist. It doesn't make it work well enough. And as you can see, there's different severities of drug interactions. They start at minor and go all the way up to contraindicated. Minor being that there's really no significant drug interaction, or it's not really going to be seen clinically. It's not going to be harmful. It's in theory, it's there, but it's not something that we pay a whole lot of attention to. You get into the moderate and major, and that's where I feel like the pharmacist can have more, can help the patient more. Your moderate interactions are those that you don't really have to preemptively seek out a change. You can counsel the patient or maybe alter how it's given or when it's given, and then just monitor them and counsel them from what could happen if it happens to let you know. The majors, we get on further down the scale. That's where we're going to get a little bit more concerned. That's where we're going to probably get the doctor involved to say, this patient's taking this drug and this was prescribed. Are you aware of this? What can we do to prevent any kind of adverse effect? A lot of times we can choose an alternative. We can separate the dose, the timing of one drug versus the drug that it's interacting with, just like we can with moderate, but we have to pay a little bit more attention to the major interactions. And there also can be some contraindications. And that means that those probably should not be combined, and that's where we've got to pick up the phone and call the doctor and say, hey, let's work on maybe trying to pick something else for the patient, because there's enough guidance out there to suggest that they shouldn't be taken together. There are different types of interactions. Probably you just think about drug-drug interactions, and of course that's the primary thing that as a pharmacist thinks about as well. And that typically happens because a drug can change the way that the liver metabolizes the medication. And when that happens, that's when we start to get the drug interactions, because most of the medications are metabolized or broken down by the liver. And when they start altering those enzymes, that's when we get into trouble. So that's when we have to get involved and watch those. Drug-food interactions. A lot of times certain foods interact with medications. I'll give you an example. If you take warfarin or Coumadin, you have to be careful with how much green leafy vegetables that you eat, because that's rich in vitamin K, and that reverses the effect of warfarin. So it's something that you have to be mindful of. And that's something that the pharmacist can help you with as well. Not to pick on warfarin, but alcohol. Just like the green leafy vegetables will make your blood too thick, alcohol with warfarin makes it way too thin. So you have to be careful with that, and alcohol interferes with several other medications as well. Just a couple other examples. Grapefruit juice interacts with certain cholesterol medications. And sometimes dairy. There's a class or two of antibiotics that dairy and those antibiotics, you have to separate them by, because the antibiotics will bind with the calcium in those dairy products. There's also drug-chemical interactions. Big one here is smoking. A lot of psychiatric medications, their effect will be much less because the tobacco and nicotine increases how quickly the body processes them. So that speeds that up, and so we don't get a big of an effect from some of those psychiatric medications. Drug-disease interactions. Big one here, think about with kidney function. Fortunately, that's where pharmacists can get involved and can help you dose reduce some of those drugs into a more safer and more appropriate level. But there's also other things. A lot of blood pressure medications interact with asthma. So fortunately, there are several other classes of blood pressure medications that we can put you on. Some other ones would be Sudafed, something that you can get over the counter. You have to be careful about your OTC drugs as well, because it can interact with high blood pressure. And Tylenol with liver disease. That's a big one. We certainly have to be mindful of that. And there are some cases where drugs can interfere with laboratory tests. They can cause false negatives and false positives, but that's why it's important to make sure that everywhere you go, you have an active list of your medications. And you keep that list active, and all your doctors know what you take, because even when you come to the hospital, that's going to be one of the first things that we ask for. So factors that contribute to interactions: if you take multiple drugs or use multiple doctors, that can increase your interactions. If you have multiple disease states, and like I said earlier, at advancing age, you're going to take more medications and not taking your medications as prescribed. So let's go over some medication do, some of the things that we want you to do. We want you to participate. It's a shared responsibility between you, the doctor, and the pharmacist, and because a more informed patient is going to be somebody who has better health outcomes. Make sure that you read the label and you're taking your medication as it's prescribed, and you follow the advice of the doctor and the pharmacist. And like I said a minute ago about the list, this is your take-home point of the day. You want to make sure that you have an active list of all your medications. So if something changes, create you a new list, scratch it out, make the change, because it's very important that everybody knows what drugs you take, how you take them, when you take them, why you take them. So that's the most important thing, and make sure that you share it with all your doctors and your healthcare providers. Some more medication safety do's. Make sure you're storing them appropriately. Most patients store their medications in the bathroom and in the kitchen. Those are probably not the best two places, because moisture is in the bathroom and heat in the kitchen. So find a place that's away from children and pets, that's away from direct sunlight, and that typically stays at room temperature, and that's going to be the best place to store them. And be careful, because a lot of medications have to be stored in the refrigerator. Insulin, for instance. When you get it and you're not ready to use it, stick it in the refrigerator. just pay attention to that, because it should be labeled when you get it from the pharmacy, but just in case it isn't, ask if you think it should. And like I just alluded to, when in doubt, ask. We want you to ask us questions. Pharmacists are the most accessible healthcare providers out there. If you're on vacation in Utah and you have a question about a medication, guess what? You can walk into that drugstore and ask that pharmacist a question, even though you're from Silicaca and get your prescriptions filled here. So utilize us. We're here for you. We're here to make sure that you have good outcomes, and an informed patient will always have better health outcomes. Let's talk about some things that you don't want to do. You don't want to take other people's medications. Give you an example. You may have a neighbor across the street that takes metoprolol. There are two different types of metoprolol. There's immediate release and extended release. You may be on the immediate release and you call your friend or neighbor and say, can you spare me a couple of those because I'm out for the weekend? Well, they may take the extended release option, and you take that twice a day, and that could be potentially a type of not interaction, but it could lower your blood pressure more than you want it to be. And you don't want to alter medications either. A good rule of thumb is if it doesn't have a score on it, meaning it has a line down the middle of it, it shouldn't be altered. A lot of extended release formulations, like the metoprolol that I just talked about, they don't need to be manipulated in any way. They don't need to be cut in half. They don't need to be crushed. So just always ask before you do something like that. And don't take expired medications, because if they're expired, you're not going to get the full effect of them. And if you have medications that you no longer need, and you need them out of your home, you can take them to the police department here in town. Any day of the week, they have a receptacle in there. It's an old post office box. You can take them in there and drop them off, no questions asked. So that's a great way to get unnecessary medications out of your home. Some additional don'ts is you don't want to change the dose or frequency or how you take them. And you don't want to stop taking medications just without talking to someone, because we take them to alleviate symptoms. We take them because we have long-term effects, long-term health conditions, and just don't stop them without consulting with somebody. And the bottom slide is a little bit more applicable if you have kids or grandkids that take liquid medications. The old-fashioned take 1 teaspoon every 8 hours. Well, a teaspoon can vary by 2 to 3 milliliters in how much it measures. So if you have one brand of flatware and somebody else has a different brand, it may not be 5 milliliters, which is a teaspoon. So always you want to use either a dosing cup or a oral dispensing syringe, which you can get anywhere from any pharmacy. All right, so let's talk about adherence, because I just talked about how you don't want to stop medications, and it's important to take them as they're prescribed and how the label indicates. 50% of patients with chronic illnesses don't take their medications as prescribed, and 55% of the elderly are not compliant. Well, that has consequences when you don't take them like you're supposed to. It could be life-threatening. We take them, like I said, to decrease symptoms and to manage conditions. So it's going to decrease our quality of life. Could cause preventable hospitalizations. And look at the figure at the bottom. $500 billion of avoidable healthcare costs annually in the U.S. So 16% of the total healthcare costs could be prevented. Give you a couple of examples. You have heart failure, and you decide you don't want to take your medicine any longer, or whatever the reason may be. And then after a week or so, you start gaining fluid, and then a little bit longer, and you get where you can't breathe. You're going to come to the ER, and that could have been prevented because of taking the medication. Or if you're up in the hospital and you have pneumonia, and we're going to keep you 3 to 4 days, and we're going to get you on the mend and get you some IV antibiotics, and then send you home on some tablets. If you don't take those tablets, you're probably not going to get over it. So a lot of times, just taking the medication as prescribed can prevent a lot of unnecessary costs. This is just a slide I'm only going to touch on, but that I really like. It breaks down the 5 dimensions of why patients don't take medication. So you've got social and economic reasons. Patients may not be able to afford their medications. Healthcare system related. It takes a long time to get in to see doctors, especially specialists. It can be condition related. Take, for instance, depression. It takes, several weeks if you are newly diagnosed with depression before you see any benefit from taking a medication. So a lot of times patients quit those because it hadn't changed anything. So and that's one thing that I always try to educate patients on is don't stop this, because it's going to be a while before you see the desired effect. That can be therapy related, because if you have high blood pressure, you may be on those medications for a long time. And then patient related, you don't really understand the benefit of taking them. So there's a lot of things that go into taking. There's a lot of things that go into why patients don't want to take their medication. A lot of research has been done on that. So a few slides on how a pharmacist can really help with patients taking their medications. A lot of times, especially our senior adults, because it's already established that they take more medications. They have limited income. They're on fixed incomes. And that's where pharmacists can really get involved to find alternatives. Use generics when applicable. There's patient financial assistance programs out there. If you can't get off the brand drug, that we can help you apply for and assist you with that. A lot of times there's coupons that we can use, and samples are always an option if we can get them from the doctor's office. Forgetfulness, I know if I've ever taken anything, I'm bound to forget something. I have to set a reminder on my phone. So pill boxes offer a good solution to that. And we can help fill up those pill boxes for you. I filled up plenty and don't mind. A lot of times patients that have visual and hearing impairments often need this. And they make pill boxes now that will unlock at a certain time. They'll alert you with a sound, send a notification to your phone that it's time to take. So, and that's where we can help in that regard and making sure that you're taking them. There's medication-related factors. Timing of doses. Sometimes we have to take things 2 or 3 times a day. That's sometimes just how it is, but we also can use extended-release formulations when applicable. So you get something down to just taking 1 time a day. A lot of things there's one thing I didn't put on the slide is, a high pill burden, meaning that you take several medications. Well, a lot of things are blood pressure medications in particular come in combined tablets. So if you take lisinopril and HCTZ and you take it separately, there's a good chance that they make a combination tablet that contains both of those. So you decrease the tablet by 1 and you decrease the copay off of it. So a lot of times, especially for blood pressure medications, we can help simplify those regimens. One, it drops 1 pill that you take and it saves you money. And there's other things that affect patient non-adherence, like I mentioned earlier, vision problems, hearing problems, swallowing problems. If you can't swallow a pill, oftentimes pharmacists can crush it if it's crushable and make it into a suspension for you or a liquid that you can take. So there's a lot of avenues that we can help. But like I said, going back to, let us know that you need help. Because we want to help you, we're here to help you. So, like Ms. Vanessa said earlier, the service lines that we've increased recently, and an area that we can help is our pharmacy services. In addition to the inpatient pharmacy, we have 2 other licensed pharmacies at the hospital. There's the Coosa Valley Apothecary, which is located in the main lobby of our facility. It's open to the public. It's a service to our employees. Our employees get their prescriptions filled there. And we have a prescription discharge delivery program that we take the medications to your bedside. So if you're an inpatient at the hospital and you're going home on some medications, you're going to get a visit from one of our technicians asking you if you would like us to deliver the medications to you before you go home. And if the answer is yes, we're going to bring it to you before you go out the door. So you don't have to stop at the drugstore on your way home. And that's really to emphasize readmissions. Obviously, it's a good service, but we have data to show that it decreases readmissions. Like I was talking about the pneumonia earlier. We feel better with you going home with the antibiotic that you're going to need for the next 6 or 7 days. And so that's the apothecary, and it's located in the main lobby of the facility. Our newest pharmacy is our specialty pharmacy. It's a pharmacy that's less than a year old. We opened it back up in June of last summer. It's a duly accredited specialty pharmacy, and we realized that there was a need to help support the patients of our hematology oncology clinic, and so they could get their oral chemo filled here at home. And so it's obviously, we opened it for that, but we can help you with any kind of inflammatory conditions that you may have, rheumatology conditions. But specialty pharmacy is a pharmacy that the insurance payers really say, hey, these medications cost a lot, and we're treating complex disease states. And so it takes a little bit longer for them to approve the medication, usually around 3 days, because they have to submit a lot of data to them, and they just want to make sure that you're being followed clinically and support the use of the medication, because like I said, they are expensive. But it's been a really good new addition to our service lines, and it's something that we continue to hope to grow. All right, that concludes the presentation that I have for you guys today, and I'll be happy to take any questions that you might have. Yes, ma'am.
Okay, this is a two-part question. Okay, when you take your meds, do you need to take it with water, coffee, not something hot, not something warm? Which is the best way to take your medicine? Then how long does the medicine stay in your system once you swallow it?
Okay, good question. You can never go wrong with water.
Okay.
That's the easy answer.
But do it need to be cold, lukewarm, or?
It doesn't matter, whatever your preference is. That's the easy answer. I mean, a lot of times dairy is fine, but a lot of times, sometimes it's not. Sometimes caffeine affects some medication, so like I said, the easy answer is water. And how long they stay in your system, that varies. That's a kind of a tricky question, because we're all different. It might stay in me a little bit longer than you, and that's kind of like when I was talking about dose adjustments. A lot of times we can look at your labs and decide if you need to decrease a tablet a day, but for the most part, things that you take, that you get from your drugstore and that you take at home are typically we've already gotten that accomplished, and it's just whatever the label says is how often that you need to take it. So it just varies how long it stays in your system. So a lot of research goes in to determine how often that you need to take that. So like a lot of times blood pressure medications is once a day. It hangs around all 24 hours or close to it.
One other quick question.
Sure.
Okay, like if you got to take any kind of shot medicine, insulin, whatever, do you need to necessarily take it out and let it stay out for a minute or two, or you can just take it from right out of the refrigerator?
I've always heard, and I can't speak from experience from this, but it doesn't hurt as much if it's at room temperature. But if you take it out of the refrigerator, it starts a clock of how long it's good for. So typically they're good for 28, 30 days outside the refrigerator. So if you use up a vial in that period of time, by all means take it out. But if you don't, I would probably recommend keeping it in the refrigerator.